People who suffer from atrial fibrillation are typically on blood thinners for their entire lives. But now, one area hospital is offering an alternative by way of a new operation. Nikaya Carrero reports.
To be completely honest, I did not have symptoms of A-fib, and I was surprised to know that I had it.
Nancy Brown was diagnosed with atrial fibrillation, or A-fib, 2 years ago at a routine checkup. She said occasionally she would have heart palpitations, but she didn't think anything of it.
I saw a cardiologist, and then he confirmed the diagnosis and decided which medications would be best for me. And I was just resigned to having to take them for the rest of my life because it's an incurable condition. A-fib is what one doctor described as a nuisance disorder. It will not kill you, but it can cause you to have a stroke.
A-fib is a condition causing an irregular, rapid heart rate. It leads to poor blood flow and creates blood clots. The blood clots are what causes A-fib patients to have a higher risk of suffering a stroke.
If you have a reason to seek an alternative to blood thinner, you have nuisance bleeding, you have internal bleeding, you're at fault risk, you're taking other medications which increases your bleeding risk. This is a procedure, something you want to discuss with your doctor and see if you can be eligible for this procedure.
In this new operation, what's called the Watchman device is placed into the left atrial appendage to help lower the chances of stroke. The minimally invasive one-time surgery typically takes about an hour to complete and only a 24-hour hospital stay.
We put a small IV in the leg of the patient. It's not an open heart procedure. Through wires and catheters in the back of their heart, we kind of see the pouch on X-ray and through our camera behind the food pipe. Put the device there. Once we are happy, we release the plug-in, and the plug is there in place for the rest of their life.
14 people have had the device installed successfully since Sanford Health began the surgeries back in January. Reporting for KX News in Bismarck, I'm Nikaya Carrero.
As of right now, Sanford Health in Bismarck is the only facility in the western region of North Dakota that is currently offering this procedure.